Dr. Kavita Patel now, White House Health Policy Director during the Obama administration, now an NBC News contributor. Doctor, it's great to have you. And you know, listening to Meg Terrell, it sounds like we're very close to a world where COVID is treated like the flu. Is that accurate?
Yeah, Shep, it's incredibly optimistic news that came out not just today, but also in the past months, where if we can achieve that herd immunity, a majority of us can get immunity either through vaccination or natural infection or both, we're going to be able to suppress the activity of this virus to the levels that we see with influenza virus, which, by the way, this past year we saw record lows of, probably because of all that distancing, hand washing, and mask wearing we've been doing.
Yeah, I feel like masks are, at least you do you, but I feel like masks are a part of flu season for me till I kick it. And you know, the president's going to say every adult gets a shot by May the 1st if they want it. Is that realistic?
Yeah, so the supply is there. And I think the news coming out from the president today and his speech tonight, emphasizing that all states need to have eligibility open up, which I believe they will, by the way. I think everybody wants to get people vaccinated as soon as possible. But Shep, he's doubling down on the promise by adding a number of sites directly shipping vaccine to pharmacies, to community health centers. This is going to open up access points as well. So we won't see every American vaccinated by May 1st, but I do believe that July 4th, as he's pointing to, is going to actually be a very kind of, I'll say, turning point or inflection, and what a difference a year makes.
I love the idea, and frankly cannot wait for the dead of summer, you know. The one thing in all of this that, you know, the news is so great, but the fact that it sounds like this is going to be with us maybe forever is that can add some stress. I mean, is this an endemic? Is COVID here for generations?
It does seem that way, and it is something that we have seen in the past with other viruses. So just as you put it, going from a pandemic and kind of a worldwide emergency to an endemic, where it's just a regular part of what we deal with, is something that we can fully expect. But that would mean probably getting regular boosters or regular COVID vaccines, just like we try to do with the flu. This time around, though, I hope more and more people take their COVID vaccinations, hopefully demonstrating that they are still safe and effective. Remember, Shep, we're under emergency authorizations, but I expect soon we will start to see the FDA fully approving these vaccines as more data accumulates. And I do think we should take a moment to reflect that we're still going to have millions of people who were dealing with these kind of long-term effects of COVID. And of course, the deaths and the absence, their lives, the absence in other people's lives and what that means for us. I don't think we'll ever forget it. So in that way, it will always be with us.
Yeah, and grief is in cycles, and we know the grieving part is just beginning. And on top of that, Doctor, we're all so busy. There's so much news. There's so much going on. But there's a mental health aspect of this that somehow, as a nation, collectively and individually, we're going to have to figure out how to deal with, because it's real. We've looked at the data. It's there.
Yeah, 42% of Americans are reporting that they have some form of anxiety or depression. And Jeff, that's probably an undercount, because there still is not only a stigma around mental health, we're ashamed at times to acknowledge it. But then number two, we have a lot of barriers to get to care. I hope the one silver lining out of the pandemic, Shep, has been that we can really utilize telemedicine, virtual health, and find ways to connect that do not involve driving or parking or finding a doctor's office, which can be very cumbersome. And Shep, I'll tell you, I'm looking forward to re-engaging as an individual with neighbors and community members. I think all of us are going to be really excited to see people's smiles and faces in person, to hear laughter from children. And that will also go a long way in starting to improve our mental health. But we do need to deal with it and continue to deal with it probably for decades.
Shepard Smith here. Thanks for watching CNBC on YouTube.